You.
Well, if you think or want the government in charge of your health care, you may want to talk to one Shauna Holmes. She is a Canadian brain tumor survivor who just shared her story with U.S. lawmakers today. Shauna's here to share it with us. Shauna, I understand you were in pretty bad straits, and then what happened?
Yes, I was. I actually started to come down with some pretty nasty symptoms and went to see my family doctor in Canada. And unfortunately, I was going to have anywhere from a 4 to 6 month wait to see 2 different specialists.
What were the specialists you needed to see?
I needed to see a neurologist and an endocrinologist. And I had already had my eyes tested by an optometrist, and I knew I was going blind, and not to mention all the other symptoms that come along with a pituitary brain tumor. And I traveled down to the States, to Mayo Clinic in Arizona, and got a diagnosis.
Now, when you went to the United States for your diagnosis to confirm you did indeed have a brain tumor, a diagnosis that would have come many months later if you were lucky, in Canada.
Right.
Did you pay out of pocket for the treatment you got in the United States?
I most certainly did. I came down to the States, and within 1 week I had seen every specialist that I needed to see. And 2 of my doctors actually were Canadian doctors, and they said to me, "This is what's wrong with you. Go home and get this taken care of." And so I went home thinking, great, I know what's wrong. Now I don't have to wait to see these specialists, and we can get this treated and move forward. But unfortunately, that wasn't the case.
So you're okay now?
I am.
Good, I'm glad to hear that. If you were in Canada and trusted the Canadian system, I imagine waiting a few months or more, the tumor would have just been galloping along, and you might not be here at all.
That's right. And I mean, the best case scenario is they had given me 4 to 6 weeks before I'd lose my vision completely. So I was very sick. There was no question I was very sick. And unfortunately, in Canada, we have a single payer system, and I couldn't do what I did in the States in Canada. It's just not allowed. So I had to actually leave the country.
What's not allowed? Going outside and going, or trying to cut to the front of the line, or both?
That's right. Not even so much cutting to the front of the line, because the line is supposed to be set up for emergency situations. Unfortunately, until you're actually in to see the specialist, how do they know what the situation is? So I'm not allowed private health insurance, and I'm not allowed to see anybody with my own dollar in Canada. So I had to actually cross the border in order to do that.
So real quickly, Shauna, there are people who argue in favor of the Canadian system, saying that cases like yours are an exception. They're not the rule. And by and large, most people benefit far more under such a system and get health care and treatment that they otherwise wouldn't have gotten, let's say, in the United States. What do you say?
I disagree with that, obviously. I think that it's a great system if you're healthy and, you know, you have a sore throat or something along that line. But unfortunately, I'm one story of many. I could tell you many, many stories that are more tragic than mine, and ones that are absolutely minor. But people are living in pain. They're living, you know, with irreversible tissue damage, with chronic pain. And unfortunately, they're just not servicing people quickly enough. And that's something that's got to be dealt with immediately.
Shauna, thank you very, very much. Another point of view we don't often hear. Shauna Holmes, I'm happy to say, is alive and well and seeing and doing okay. Thank you very much, Shauna.
Thank you.